Andrew Parrish?
That's me.
Hi, my name is Lexi. I'll be your nurse practitioner doing your physical today.
Alright.
May I call you Mr. Parrish?
Sure.
Okay. And you are here for a pre-employment physical. What type of job are you applying for?
I'm going to be the CEO of Google.
Google, got it. And what kind of shift is that?
It's full-time.
How many hours a week would you say?
About 900. Yeah.
And really, how many hours a week?
60.
60 hours a week. Okay. To get started, I'm just going to ask you about your history. So for family history, do you have any family history? This includes your mom, dad, brothers, sisters, grandparents. Do you have any family history of cancer?
Just my dad.
And what did your dad have?
He had prostate.
And
he had colon cancer as well.
prostate and colon cancer. And he's still living?
He is.
Oh, that's great. And any history of high blood pressure in your family that you're aware of?
None.
Any history of asthma?
No.
Any history of alcoholism?
No. Well, my grandparents.
Which grandma, grandpa?
My grandfather on my dad and my mother's side.
Okay. And then any history of diabetes, of anything you know in your family?
No.
Okay. And have you ever been treated or hospitalized for any psychiatric reasons?
No.
Any history of Hep C?
No.
Have you ever been treated or hospitalized for anything related to drug or alcohol use?
Nope.
Do you have any chronic medical conditions?
No.
Do you have any episodic illnesses, like something that happens every year or something that keeps coming back?
No.
Do you have any illnesses related to your work?
No.
Okay. Have you had any history of injuries or traumas or hospitalizations?
None.
Okay. Any surgical history? Any surgeries in the past?
Just a vasectomy.
Okay. How long ago was that?
14 years ago.
14 years ago. And you live, where do you live, or who do you live with?
My fiance.
Your fiance. Any children living with you?
No, just temporary. The kids come visit.
Okay. You said you have a fiance, your children, you feel safe at home?
Oh, yeah.
Any current stressors?
No.
No. And what do you do for a living right now?
I'm the executive director of AMC Theaters.
Oh, okay. That's great. And you said you have 3 children?
Mm-hmm.
Okay. And do you identify as a male or a female? Or how do you identify?
Male.
Male. And you have female, male partners?
Yeah, my girlfriend.
So female partners only?
Yes.
Okay. And how many sexual partners in recent years?
Just one.
Just one. And now, you said you've been together 5 years?
Yep.
Okay. Any history of STI, STDs?
No.
Okay. Okay. And then I'm going to do a review of your body system. So that's a couple questions about each part of your body. You just tell me if you're experiencing these things or not. So overall, are you experiencing fatigue, fevers, chills?
No.
And with your skin, have you noticed any rashes or wounds or lesions?
None.
Okay. Any head trauma or headaches?
None.
Any vision changes or discharge from your eyes? Any ringing in your ears or ear pain?
No.
Any sinus pain or congestion?
No.
Any difficulty swallowing or swelling in your throat?
None.
Any chest pain or chest palpitations? Feel like your heart is racing?
No.
Any cough or shortness of breath that you've experienced recently?
No, not recently. No.
Have you noticed any blood in your urine or any difficulty with urinating? Any diarrhea or changes in your bowel habits from what you're used to?
All normal.
Have you noticed any lumps or any pain in your chest area?
No.
Any seizures or weakness or fainting?
No fainting.
Do you have any joint pain or stiffness or swelling?
Nothing.
No. Any easy bruising or bleeding that you've noticed?
No.
Any recent weight loss or weight gain?
No.
Frequency urinating or feel like you need to drink a lot of fluid?
No.
No.
Normal.
Okay. Do you have any anxiety, depression, any feelings about hurting yourself or someone else? No. Okay. All right, I'm gonna start with your exam, a physical exam. So I would wash my hands. And I am going to, I forgot to ask you if you have allergies. Do you have any allergies?
Oh, just seasonal.
Okay. Oh my gosh, I forgot a whole list of stuff. Let's go over that. Seasonal allergies. Do you know what your seasonal allergies are to?
Grass.
Grass. And what's your reaction with that?
Just want to start sneezing and
Sneezing and okay.
runny nose. That type
And
of
how
stuff.
old were you when you think that first started?
Like probably 8 or 9.
Okay. Do you have any allergies to food?
No.
Do you have any allergies to medications?
No.
Do you use any recreational drugs?
I do not.
Do you drink alcohol?
Once in a while.
Like on holidays?
Probably a couple, 2-3 times a week.
2-3 times a week? Okay, and is it liquor, beer, wine?
Just beer.
How many in a sitting?
1 or 2.
1 or 2. Has anybody ever told you you need to cut back on your drinking?
No, I own a brewery.
Have you ever felt the need to drink first thing in the morning to wake up?
No.
Okay. Do you vape, chew, or any history of smoking tobacco? I already asked you about drugs. I asked you about. Do you take any prescription medications?
No.
Do you take any over-the-counter medications?
Just no. Well, I mean vitamins and that type of stuff.
A vitamin. Do you take any supplements?
Just like Metamucil, or that's about it. And vitamins, and I think that's about it.
Okay. Do you are you up to date on your vaccinations, and do you get a flu shot every year?
I am up to date. No, I don't get a flu shot.
Do you know the last time you had one?
Couldn't tell you.
Okay. Do you exercise? What kind
Normal, like I don't know, once or twice a week.
like walking or going to the gym?
Going to the gym.
Okay. And what's your diet like? How many times a day do you eat?
Once or twice. Mostly 2 times. Lunch and dinner.
Lunch and dinner.
Yeah.
Not a breakfast person?
Not really.
Okay. Are you on any special diets? Vegetarian, vegan, anything like that? Okay.
I eat all of it.
Just a regular diet.
Yeah.
Okay. Twice a day. And how do you sleep at night? You feel like you fall asleep easily? You feel rested in the morning?
Yeah, no complaints there.
Okay. And how many hours a night would you typically say you sleep?
6 to 7 hours, I'd probably say. Maybe 8 on a good day.
Okay. Okay. Now I'm going to start your physical exam.
Okay.
So I'm going to wash my hands again.
Again?
And I'm going to touch your head. If you have any tenderness, you just let me know.
No.
Okay. I'm going to feel your lymph nodes. So if you have any tenderness in any of these areas, just let me know.
No.
Quite a beard. Okay, no tenderness there. And then I'm going to put my hands on the side of your face. If you could just clench your teeth and then open your mouth, and do it again. Open. Any tenderness where I'm touching?
Mm-mm.
Okay. And then I'm going to touch your neck. If you just want to lean your head back a little bit for me. And go ahead and swallow. Okay. I have a light. I'm going to have you just look forward for me. Okay. I'm going to have you follow my finger with your eyes. Good. I'm gonna take a peek at your ears, and I'm gonna touch. Tell me if you have any tenderness.
No.
Both sides. No?
No, still good.
Alright, I'm gonna take a look inside your ears.
Anything in there?
No.
No.
Okay, thank you. Oh, wait, I need this. I'm gonna have you open your mouth for me. And put your tongue down and say ah if you can. Okay, thank you. Tilt your head all the way back.
Mhm.
Tilt your head all the way forward.
Mhm.
Look over one shoulder.
Mhm.
Look over the other shoulder.
Mhm.
And then bring your ear to your shoulder.
Mhm.
Bring your ear to your other shoulder.
Mhm.
As far as you can. Is that about it?
That's it.
Okay. I'm going to have you stand up. We're going to look at some movements of your shoulders. Is it working?
I think so.
Okay.
There. What do you want me to do? I'm sorry.
Stand up.
Yep.
Bring your shoulders forward.
Okay.
Shoulders all the way back.
Yep.
Shoulders out from your body.
Yep.
Cross in front of your body.
Okay.
Take one hand and touch above your buttock. Or, yeah, your scapula, your shoulder blade. And then the other hand and do the same. And then go from the top and touch your shoulder. And the other way and touch your shoulder.
Oh, that's a good stretch.
Yeah, good stretch. You can have a seat. I'm going to keep looking at your arms. This is more movements and muscular testing. Stick your arms straight out for me. I'm going to push down. You keep me from pushing. Same thing. And bend your arms for me. Keep me from pulling. Push against my arms. And then wrists out. Make a fist. Push up. Push down. And then spread your fingers out for me. And I'm going to push in. Try to keep me from pushing your fingers together. Good. And then take your thumbs and like hook them in. And I'm going to pull on both sides. Both of your thumbs. Good. I'm going to have you bring your elbows up and down. And flip your hands. Flip your hands. Wrists up and down. Other way, yep. And then move your hands to one side and the other side. Good. Fingers out, fingers in, fingers up and down. I did that backwards. And then with your thumb, I want you to touch your pinky and then all the way down your fingers. Good. And I want you to take your hands like this, bring just your thumb out, bring just your thumb in. Good. And then Grab my 2 fingers with both your hands.
Okay.
And squeeze. And I'm gonna try to pull out. You keep my fingers. Yep.
Up to mine.
Good. Okay. I'm gonna touch your wrists and feel your pulses for a minute. You just go ahead and relax.
Okay.
Okay.
Still alive?
You have a great pulse. I can feel it very well. I'm gonna go down your legs and do some examinations on your lower legs. And I'm gonna feel your pedal pulse on both sides and your posterior tibial pulse on both sides, and feel for temperature, no coolness. I'm gonna palpate your knees. Any pain there?
No.
And your feet and your ankles. I'm gonna have you stand up for me.
Okay.
And you can do just one leg at a time. Kick forward, kick forward, and then you might want to stand one way and kick your leg backwards.
Okay.
Kick your other leg backwards.
Okay.
And then bring each leg away from your body, away from your body, across your body. Yep. And the other leg. Okay. And then I'm going to have you lay flat for 1 minute.
Front or back?
On your back. I need you to uncross your legs. And I'm going to take this leg. And this leg. You're right. Okay. And I'm going to have you stand and walk across the room for me, just regular. And then on your way back, I want you to heel toe like you're doing the sobriety test with the police. Good. And then stay standing for me. Bend all the way forward. And then,
Like to touch my toes?
if you can.
I can't.
Okay. And then bend backwards. And then bend, lean towards me and the other way. And do a twist both ways.
Oh yeah.
I've heard that. Okay, next I'm going to have you, you're going to stay standing, and I'm going to stand here so you don't fall,
Okay.
and you're going to put your hands straight out in front of you and close your eyes, and we're just going to do this for 20 to 30 seconds, and I would make sure my patient is safe and doesn't lose his balance. All right, you can stop. I'm going to have you sit back down.
Okay.
And if you could face that way as much as you can. I'm gonna now examine your heart and lungs.
Okay.
So I'm gonna lift your shirt up a little bit if that's okay.
Yep.
Okay. Deep breath for me. Deep breath. Deep breath. Again. Again. One more. And I lied. Last one. Okay. Good. Oh. Yep. I'm gonna have you lay flat for this part. I'm just gonna listen to your heart sound, so you just relax. On your right is so apical, wait, is that apical? Yes. No, aortic, sorry. Pulmonic, mitral, tricuspid, and the apical, again, can they see me? Yeah. With the bell. Aortic, pulmonic, Erb's point, tricuspid, mitral. All right, stay right there for me. Have you have your hands? No. If I suspected a murmur, I would have my patient lay laterally to the left and listen at the PMI for a murmur, or I could have them sitting up and lean forward and take a deep breath and hold it out, and then again listen in the same spot for a murmur, which I don't suspect he has one, but that is what you would do. I'm gonna have you stay there.
Okay.
Now I'm gonna lift your shirt if that's okay.
Sure.
Are you comfortable?
Greatly comfortable.
Okay. Alright, I'm just going to begin by looking at your belly, and then I'm going to listen for bowel sounds, so again, just relax.
Okay.
And I'm not seeing any aortic pulsations. I'm going to tap on your belly.
Mm-hmm.
Okay. Now I'm just going to touch, and you tell me if you feel any tenderness.
Nope. Nope. Nope.
Alright, I'm going to push a little bit harder, and you tell me if you feel any pain or tenderness with this.
Okay. Nothing. Nope. Nope.
I'm just going to press a little bit above your belly button. And then I'm going to reach across you, I'm sorry. Take some deep breaths in and out for me. One more. Okay. And I don't, any pain in that area?
No.
Okay. Alright. Andrew, I'm going to have you sit back up. And just keep on looking forward. I'm going to look at your neck. Okay. Oh, sorry. Will you lay down one more time?
Sure.
Facing that way. And then look to your right. Oh, wait. Look. I'm going to pretend like I'm on the side of you.
Sure.
Okay, now you can sit up. I'm sorry. And I'm just gonna feel your pulses in your neck. Just relax and look straight forward. Are we in the camera? Yeah.
Yeah.
I think we're almost done.
Okay.
I'm gonna have you put your back to the camera one more time. So I'm gonna touch your back below your ribs, and if you feel any pain with this, just let me know.
Okay. Nope. Nope.
No pain. Okay, thank you, Andrew. I will get all your paperwork sent in. Do you have any questions or concerns?
No.
All
Yeah,
right.
good.
Thank you. Have a nice day.